Assalamu alaikum. New topic, which is cancer. We will discuss in detail about cancer and its types and what is the probability and what is the percentage of the people suffering with this disorder. First thing, you should know what is cancer. Cancer is a term which is used for diseases in which abnormal cells divide without control and are able to invade other cells. Actually, in a normal person, every cell divide under controlled. Every cell have its specific time when it will divide and how many time a cell will divide. But in case of cancer, a cell divide continuously without any control, and sometime the cell which is continually divide may invade into other tissues, and it can be dislodged from the place where it actually form and move to other body part. Cancer cells spread to other parts of the body through blood or lymph system. Cancer is not just one disease, but many diseases are concerned with it. More than 100 different types of cancers are investigated in the world, according to National Cancer Institute. So here you can easily distinguish the development and the growth of normal cell versus a cell which is cancerous. In normal cell division, a single cell divide into two cells, and then each cell further divide into two cells. And for example, if this cell is damaged, a natural process occur in organisms which is called apoptosis, and apoptosis is a programmed cell death which is necessary and which is beneficial for the body of organisms if the apoptosis takes place in organism body. So in a normal person, apoptosis occurs when a cell is damaged and when a cell is not perform its proper function. And in case of cancer cell, for example, this is a cancer cell and it will continually divide. For example, when when a cell divide, it form two new cells. But in case of cancer, rather than two, many cells formed, and all the cells are immature and these cells not perform any function. But these cells utilize the nutrition of the body, and due to this, the normal cells not get any nutrients for proper growth, so the whole body suffer due to this disorder. Main categories, the first one is carcinoma. All these categories are actually the cancer. Carcinoma, cancer that begin in the skin or in tissue that line or cover internal organs. There are number of subtypes of carcinoma. For example, adenocarcinoma, basal cell carcinoma, squamous cell carcinoma, and transitional cell carcinoma. When a cell when the your skin cell or tissue cell damaged and they show uncontrolled divisions, it means you are suffered with carcinoma cancer. And when we are talking about the sarcoma, it means the cancer that begin in bone, cartilage, fat, muscle, blood vessels, or other connective or supportive tissues. Leukemia, as the name indicates, a normal person contain three types of blood cells. The first one is red blood cells, white blood cells, and platelet. And the second name of white blood cells is a leukocytes. So when the white blood cells show uncontrolled division, and this disorder will be leukemia, and this cancer will be leukemia. Then what is lymphoma and myeloma? It is a cancer that begin in the cells of immune cells. As you know, white blood cells are actually the immune cells that has two categories, agranulocytes and granulocytes. And in agranulocytes, the further two categories, lymphocytes and monocytes. And lymphocytes, if the lymphocytes show uncontrolled division, then this cancer will be lymphoma and myeloma. Then central nervous system cancer that begin in tissues of brain and spinal cord. Then we will discuss what are the causes and high risk population and what are the consequences, what are the results of the cancer. So the major cause of the cancer is a cigarette smoking. People who do smoking are at high risk of cancer than the people who are non-smoker. Then a malnourished people, a person which get diet which is imbalance, not contain all the necessary nutrients which a person need for its normal growth. It could be cause cancer, or if a person take unhygienic food that contain multiple bacteria, viruses, protozoans, and that virus, bacteria, or protozoan get enter into the body of organism, and it alter the function of the body and may cause cancer. Then physical inactivity is also the reason of cancer. Occupational exposure, viruses, biological agents, reproductive factors, and alcohol consumption is also the cause of cancer. So, cancer could be due to genetic disorder. It may be run from one family to other. So, who are most susceptible to the cancer? Most susceptible person is a poor people, which cannot get enough food to feed its body. So, malnourished people are at high risk of cancer, and less educated people who are not aware about this disorder. Then facial and ethnic minorities, person with a family history of the cancer, as I discussed, it could be a genetic disorder. And what are the sequences of the cancer? High healthcare cost for treatment. It is very expensive treatment, and a poor people cannot afford to treat. Then lost work productivity, insurance denial, disability, psychosocial problem, treatment complications, and it may cause increased risk of second cancer, and premature mortality could also be due to cancer. So, cancer contain different stages based on size and extent of primary tumor, whether it has spread to other tissue, other areas of the body or not. Primary staging is used for descriptive and statistical analysis of tumor registry data. Cancer cells are present only in layer of cells where they develop and have not spread. The stage is in situ, and if the penetrated beyond the original layer of tissue, the cancer is invasive and categorized as local, regional, or distant stage based on extent of the spread. Basically, it have two types of cancer could be. The first one is a benign, and the second one could be a malignant. Benign, actually a group of cells which show uncontrolled division, will be consistent at that particular place where they actually form. But in case of malignancy, the cancer cells which show uncontrolled division, where they form will move to other parts of the body. So that show metastasis or malignancy. So, at early stages, we can diagnose the cancer, and we can treat the person. But if a cell continually divide and invade the other cells, it is very hard to treat that person. So, then next is TNM staging, assessing tumors in three different ways: extent of primary tumor, absence or presence of regional lymph node involvement, and absence or presence of distant metastasis. Once the T, N, and M categories are determined, a stage of 0, 1, 2, 3, or 4 is assigned. At 0 stage is in situ, stage 1 is early, and stage 4 the most advanced disease. Some cancer have alternative staging systems, for example, leukemia. Then here is the estimated number of new cancer cases by the whole world in 2018, and the world uh, uh, in the cancer in the whole world is spread, and this is not a particular one country where the cancer cases are high. So, proportion of cancer caused by major risk factor and level of economic development, as you can see here, the diet plays 30% role in here, and infection plays 26% role, and other factors could be 44%. What are the facts? Mortality in 2014 in American population, about in one day 1600 people were die with cancer, and in second most common cause of death in US is exceeded by heart diseases. And in when we talk about the survival, 5-year relative survival rate for all cancer diagnosed between 2003 to 2099 is 68%, up from 49% in 1975 to 1977. So survival statistics vary by cancer type and stage are diagnosed, but now it is 2024, and the cancer cases are more spread, and the more people are susceptible to the cancer than the data that I have discussed here in 2014. New cancer cases are also described in 2010. In 2010, more than half of all new cancer cases of the prostate, female breast, lung, and colon and rectum cancer are also diagnosed, and many cases are diagnosed for the people have lung cancer, prostate cancer, female breast cancer, and colon and rectum cancer. Here is a graphical representation that shows the people who are suffered with different types of cancer. All cancer combined incidence rate by state 2010. Here you can see, and different areas contain different people who suffered with different types of cancer with different probability. Here is a graphical representation, and the people with age 85 are more susceptible than young age people. So here is also a statistical analysis, and the new cases of all cancer, delay adjusted cancer incident by sex. So all these graphical representation that show the cancer cases of different type of cancer, that could be stomach, ovary, uterus, colon, rectum cancer, pancreas, breast cancer, lung cancer, and bronchus cancer as well. How a person could be treated: surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, hyperthermia, stem cell transplantation, photodynamic therapy, laser, blood product donation, and transfusion. All these types can be used for treatment of cancer patient, and complementary and alternative medicines could be used to treat the cancer, and supportive care is also could be done in case of treatment of the cancer. So, what are the side effects? Physically, when we use chemotherapy, we use different chemicals for the treatment of cancer. But that chemical, when entering inside the body of the organism, can actually alter the function of normal cells, and it can cause vomiting, fatigue, anemia, and all other disorders as well. And emotionally, it also disturb the person, and the person suffered with more anxiety, fear, depression. uh, and as I already discussed, the treatment of the cancer is very effective, is very cost effective. A normal person and a poor person cannot afford this cost, and it is very hard to treat that persons. And worldwide economic cost of the cancer is $895 billion, and it is actually a very high cost of to treat the cancer. The cost of direct medical care for cancer estimated to account for 5% of national health care spending, and in 2004 it was $72 billion, and in 2010 it was $125 billion, and it is estimated to increase up $178 million in 2020, but now it is 2024. The cost of this cancer is much higher than 2020. Then it is a ACA, expand public coverage by removing the medical eligibility categories and raising the economic threshold, allow all non-elder, non-disabled citizens and legal US resident with family income below 133% of federal poverty level, are about $30,000 per year for a family of 4 to be eligible for Medicaid benefits. Extend coverage to low income childless adult, providing them with assessed to prevent care such as colon breast cancer screening, anticipated that more people with cancer can be diagnosed and treated at an early stage, thus increasing their chance for the survival. That's all about cancer. I hope you understand the lecture. If you understand the lecture, please like the video. Stay connected. Allah Hafiz.